is made of 4 chambers from a front view. The upper 2 chambers are the right atrium, the left atrium. The lower 2 chambers are the right ventricle and the left ventricle. From a front view, most of the front view kind made of mainly by the right atrium and the right ventricle, and the lateral most part by the left ventricle and the left atrium. This is not the case in the back of the heart. If we look to the back of the heart in this mannequin, this is the back of the heart. How we know the back of the heart? By this transverse line, which we are going to discuss it soon as coronary sinus. The back of the heart is made mainly by the left ventricle and the left atrium, and the right ventricle is a very small area. Okay, to start with parts of the heart that can be shown in this mannequin. This is the pulmonary trunk. Pulmonary trunk is the one that is going to carry blood from the right ventricle going to the 2 lungs, so it will divide into right pulmonary artery and the left pulmonary artery. Next to it, I have the aorta. The aorta starts by ascending aorta, and then it's going to be the arch of the aorta, and then will go down as descending aorta. We have blood coming from the upper half of the body through the superior vena cava, which is this big vessel. What about the lower half of the body? Blood is coming by the inferior vena cava, which is this opening 4. This is for the inferior vena cava. What are these lines? These are the coronary arteries and veins. The red ones are the arteries, the blue ones are the veins. Those for the supply of nutrition for the heart as a muscle, and the veins for the drainage of the waste. Where the waste is going to be drained, let's start by the coronary artery first. The coronary arteries arise from the aorta at the very early beginning, and then soon divide into right coronary and left coronary to supply nutrition for the heart. The coronary veins are going to carry the waste from all the chambers of the heart. Is going to be drained into this coronary sinus I just mentioned in the back of the heart, where this coronary sinus is going to drain these waste products of the heart is going to be into the right atrium. Okay, now we need to study the heart from the interior. When you study the heart from the interior, we have 4 chambers I just mentioned. This is the right atrium, right ventricle, left ventricle, and left atrium is not open, which is that one. The valves of the heart from right to left, we have this valve which is guarded by these chordae tendineae or bands like for firm closure of this tricuspid valve. So the first valve, we can name it as AV valve. It's called the tricuspid valve between the right atrium and right ventricle, and a firm closure of this valve by these chordae tendineae. Where they attach? They attach into the papillary muscle. Where this muscle is attached? To the walls of the heart, the myometrium. We have something very unique to the right ventricle only. This green thing is called moderator band. It's only for the right ventricle only. This is the interventricular septum between the 2 ventricles. The other valves, I mentioned the first one, the tricuspid valve. We have on the other side another valve called the bicuspid valve. Wherever we have chordae tendineae, it should be an AV valve like this one. But this one is named the bicuspid valve as it has 2 cusps only. You can name it also as mitral valve. Okay? Now we have 2 other valves. They both look like a semi-lunar in shape. One is the pulmonary valve, which is this one, and the last one is going to be at the very early beginning of the aorta. It should be this one. You can name it also as semi-lunar valve. These are the 4 valves of the heart and the interior of the heart. We'd like to discuss fetal circulation. We have a very good mannequin here. This, we can name it as the placenta. This is the placenta. Coming out from the placenta is the umbilical vein, which is going to be the main artery supply to the baby's heart, like that. Umbilical vein, we can represent it by this one, okay? Umbilical vein is coming from the placenta, which should be inside here. The liver in the baby is not yet mature, so it's going to bypass the liver by having this ductus venosus. The last piece going to the baby's heart is going to be named ductus venosus. Why? Because the liver is not yet mature, so it will bypass the liver. One more thing inside the heart of the baby, the two lungs are not yet mature, so the baby's heart is going to bypass the two lungs by making a connection between the pulmonary artery and the aorta on the other side, and the connection is going to be named ductus arteriosus. So this one is the ductus venosus, and the ductus arteriosus is going to be between the pulmonary vein, which should be this, and the aorta, running from the venous side to the arterial side, bypassing the two lungs. This is for the pulmonary circulation. Stop it.